absolutely. And any specific points that you particularly want to make, being in the system, being in the setup, that you feel that, you know, if their health steps in? Because even when we talk about state-sponsored health cover, and while that access is improved for the poor, there are still a lot of hospitals who complain of delayed payments, unpaid bills, and those cases are out there.
So I think that there's going to be a large trial and error. I think there's multiple systems that work around the world. US is considered a very expensive, bad model with a lot of people falling through the cracks. Canada is a little bit better, but they have their own limitation. One thing is I find is the Taiwanese model, which doesn't give you a whole lot of payment, but almost admin costs are almost 0.1% of the treatment, whereas it focuses more on patient care. So we are having to go to some sort of cross model. I think with that, you have to have an efficient payment system, an efficient system for the government to act. It can't be, okay, I may get 50,000, but I know I'm getting 50,000 rupees on day one. It can be, I may get 1 lakh or 1 crore after 1 year, 2 years, question mark. I don't know when the money is going to come or not come. So I can't plan my payment system, or how do I cross-subsidize. If it comes in a quick, efficient system, even if the payment is a little bit less, we can actually predict and know how much we have to spend and how much to cross-subsidize. But if you put this questioning method, I don't know when the cash flow is going to come in, for any insurance company, not just government, then that really puts a strain on the hospitals.
You want to add to that?
Well, I completely agree with Dr. Arun. We don't wait to extend our services just because the government has delayed payments to us. We never deny. We understand these delays are part and parcel of day-to-day life, and we go on doing what we think is right. So eventually the payments would come, and then we understand completely.
Also, Professor Ashwini, the other point I want to talk to you about is greater transparency. While you do make a point to say that digitization has largely helped on that front, and I also say this from the point of view of running an educational institute that imparts medical education, in every which way, from how the students are admitted to how the procedures happen in the hospital, how has that changed over the years?
Well, as you may be knowing, that right now we cannot admit any student who has not come through NEET in the medical college, and similarly in dental college through national eligibility tests. And it's a very transparent process. The merit is very much seen by every candidate. And we cannot bypass any candidate and admit the one who is not, who is above this particular candidate. We cannot bypass any candidate. So we strictly go by norms, and there is a complete transparency. And fortunately, in case of our institute, CIMETS, as well as the Savita Dental College, in the second round itself, most of the admissions take place. And hardly we go to the third round, and we have a full quota already. And there has never been a controversy in our admission so far. So we maintain that transparency. Similarly, in digitization also, our records are very much transparent. It can be seen by anyone. Absolutely transparent. And you need only patient ID, and you will get the entire database related to that patient, whether these are clinical tests that have been done, or diagnosis that has been done, the prescription that has been given by the specialist. Everything is listed, and it is accessible to anyone. In fact, our students can also visit to study the cases. They can actually go back and visit the entire record of our patients to learn. So this is the advantage this digitization gives to you. So all these facilities are very, very transparent, absolutely transparent.
So I think so that we're going to a much stronger sense of transparency. We're going to electronic records, universal health ID. Government is heading in the right direction. The one negative which we have seen, I think, hospital sees on the postgraduate side, is that you can no longer choose the people training under you. So you don't know if they're dedicated and they're going to stay with your organization. If I were to tell you that you're going to train a young journalist, it may be very transparent that she's selected through your score, but then you don't know if they're going to be with you. They're not going to be with your organization in the long term. They may just say hi and just disappear. It helps a little bit in the long term with institution building. So that's the only downside. But it does help on the transparency side now. If anyone asks me any questions, I can be very transparent. And it's very open that I can't alternately influence it in any other way.
The other point I want to come to you, Professor Ashwini, is of retaining talent in India. You know, while we have incredible talent, but there is also this chatter about doctors, researchers, students seeking education or wanting to work abroad while they're all homegrown. How is it that we create that environment to ensure that we can keep them to ourselves and help us flourish?
That is a very fantastic question. I'm very proud and happy to inform that Savita Dental College, which is country number 1, topmost dental college for last many years, has 650 dental chairs, several clinics, and a busiest dental college with 3,500 patients every day. And what we charge is 300 rupees to 1,000 rupees. It's the cheapest care, but the best state-of-the-art care that we provide. If you look at our college, dental college from outside, we have made it as a temple of dentistry. It looks like a temple with Ganesha holding the dental instruments, the instruments that are used. And 9 specialities, Ganesha is shown to or depict to take care of all these specialities. And inside, you have state-of-the-art facilities. And that attracts students, researchers, as well as specialists, not only from rest of India. Savita is a big name as far as dentistry is concerned throughout the country. But also we are one of the topmost dental college in the world. And therefore, specialists as well as students come from USA, from Australia, from UK, from Southeast Asian countries. You name it and we get it. We have over 200 MOUs with different institutions. And there is a student exchange program. Our students go abroad, and last month itself, we had 100 visitors from different countries who took training in our dental college. So, why students have to go abroad? Of course, you visit, see how those countries work as far or provide healthcare to their people. But believe me, the number of patients and the kind of exposure our students get is not available elsewhere.